Hi, my name is Dr. Jolene Andrick, and I'm a board-certified facial, plastic, and reconstructive surgeon with Aurora Advanced Healthcare. What I'm going to discuss today is about brow elevation, or when a brow surgery is needed, especially in regards to medically necessary eyelid surgery or for cosmetic purposes. The proper position for an eyebrow in women is different than men. A woman's eyebrow should have a natural arch and be above the orbital rim, which is the bony margin that we can feel above our eyelid socket. A man's brow should be at the orbital rim or a little more flat. Typically when we age, or characteristically because of hereditary changes, that brow might be lower than expected and might cause heaviness or fullness or undesired cosmetic changes. Sometimes people come in because of aesthetic purposes and they want to have their eyes rejuvenated. They often don't think that their brows are the problem, but a physician who is well trained and well prepared in evaluating eyebrows should be able to assess that very carefully. There are many different considerations and techniques for brow lifting. It is the surgeon's preference, but also how well trained the physician is, because not everyone requires the same procedure. In today's technique, I will often use an endoscopic approach, which makes 4 little nicks or incisions into the scalp. These are not visible and will have the hair growth completely through them, but they allow full access to the forehead so there is nothing visible. In addition, for a gentleman who's lost their hair, we make the incision on the eyelid where the eyelid skin is removed so that they don't have any other visible incisions as well. So it's very aesthetic, very natural, and the brows are raised to their same shape and position that they used to be when they were younger. A typical brow lift is done under mild sedation. So an individual will have their hair taped aside if it's required, and they will have markings made in the OR. And then typically those incisions are made very carefully and the brows are re-supported. There should be nothing visible or external, but the distortion will occur after the first 24 hours because of swelling. Once that dissipates very quickly and the headache is gone, the individual will see that their brows are in a very natural and normal position, but the forehead swelling goes down very fast. So most people find that a casual observer will not notice that they had their brows elevated, because most people actually tend to give a little tone and support their brows when they're droopy, and now their brows are naturally in that same position. So it becomes really rewarding and very light, and they feel like the heaviness has gone from their forehead, but they no longer have the weight, and they look very natural and very normal. There's no change to the shape of the eyebrow, and they look like themselves again.